Did you know that the way you measure your blood pressure could be causing artificially high or low readings? Millions of people unknowingly make simple mistakes that lead to misdiagnosis, unnecessary medications, or even ignoring serious health conditions. Today, we'll uncover the 11 most common mistakes people make when measuring their blood pressure, mistakes that even some healthcare providers fall into, and how you can avoid them to get accurate readings every time. Accurate blood pressure measurement is vital because this number can determine your risk for heart disease, stroke, and kidney failure. With proper techniques, you can ensure you're managing your health effectively and confidently. Let's dive in. Mistake 1. Using the cuff over clothing. Blood pressure cuffs are designed to work on bare skin, yet many people, whether at home or even in a doctor's office, place the cuff over their clothing. Studies have shown that doing so can lead to a 10 to 20-point increase in systolic readings. This difference can be significant enough to misclassify someone as hypertensive. The 2018 Journal of Clinical Hypertension emphasized that for accurate results, cuffs must be placed directly on the skin. The resistance created by fabric, especially thicker materials like sweaters, impacts the sensor's ability to measure pressure effectively. Pro tip: always roll up your sleeve or wear short-sleeved clothing when you know you'll be checking your blood pressure. Mistake 2. Incorrect arm positioning. Did you know that your arm's position relative to your heart can skew blood pressure readings? When your arm is below heart level, readings can appear artificially high. Conversely, if your arm is too high, it may falsely lower the reading. This issue often occurs at home when people rest their arms on a table that's too low or at a clinic where the nurse forgets to position the arm correctly. Research insight. A 2021 study in hypertension research found that improper arm positioning accounts for errors in nearly 25% of home blood pressure readings. Solution: sit in a chair with your back supported. Rest your arm on a table so it's at heart level. Use a pillow if needed to elevate your arm. Mistake 3. Using a tight or loose cuff. The fit of the blood pressure cuff matters immensely. If the cuff is too tight, it can compress your arteries excessively, causing artificially high readings. On the other hand, a loose cuff may fail to measure the pressure accurately, leading to numbers that are falsely low. How to check fit. You should be able to slide 2 fingers between the cuff and your arm comfortably. The cuff should be snug, but not so tight that it pinches your skin. Industry standards. The American Heart Association, AHA, advises using a cuff that fits the circumference of your upper arm properly. For larger arms, opt for a larger cuff to avoid errors. Mistake 4. Testing right after activity or stress. Blood pressure is dynamic, meaning it changes depending on what your body is doing. Checking your blood pressure immediately after physical activity, like climbing stairs or rushing to an appointment, will almost always give elevated readings. Similarly, stress or anxiety, like what many people feel in a doctor's office, can also spike blood pressure. This phenomenon is known as white coat syndrome, where a person's blood pressure rises in medical settings due to anxiety. According to a 2019 European Heart Journal study, white coat hypertension affects nearly 20% of patients. Solution: always rest for 5 to 10 minutes in a calm, seated position before checking your blood pressure. If you're at the doctor's office, request a few moments to relax. Mistake 5. Having a full bladder. A full bladder can increase systolic pressure by 10 to 15 points. When your bladder is full, it activates your sympathetic nervous system, causing a mild stress response. This issue often goes unnoticed, but is a common factor behind inaccurate readings. Study insight. A 2020 report in the Journal of Human Hypertension highlighted that patients who emptied their bladder before testing showed significantly more accurate readings. Tip: always visit the restroom before measuring your blood pressure, especially if you've been holding it for a while. Mistake 6. Crossing your legs. Sitting with crossed legs may feel comfortable, but it can artificially raise your systolic pressure by up to 10 points. This happens because crossing your legs compresses blood vessels in your legs. slightly increasing your overall blood pressure. Proper positioning. Sit with your feet flat on the ground. Ensure your legs are uncrossed and relaxed. In clinics, remind the nurse to check your positioning, as this mistake is surprisingly common. Mistake 7. Consuming caffeine or alcohol before testing. Caffeine, found in coffee, tea, and energy drinks, is a potent stimulant that can elevate blood pressure by 20-40 points for several hours after consumption. Similarly, alcohol can temporarily raise blood pressure, especially in larger amounts. The 2017 Journal of Hypertension confirmed that caffeine's effects on blood pressure could last for up to 3 hours after ingestion. Best practice. Avoid consuming caffeine or alcohol for at least 2 to 3 hours before measuring your blood pressure. Mistake 8. Measuring the wrong arm. The left arm is generally preferred for blood pressure measurements because it is closer to the heart. Using the right arm may produce slightly higher readings. However, the difference is minimal if your arms are symmetrical in terms of circulation and structure. Exceptions. If you've had surgery or medical procedures on the left arm, use the right arm. Always use the same arm for consistency when tracking your blood pressure over time. Mistake 9. Using a wrist monitor. While wrist monitors are convenient, they are not as accurate as upper arm cuffs. The reason lies in the position of the wrist relative to the heart and the smaller arteries in the wrist, which can skew readings. Research Insight. A 2019 review in the Journal of Medical Devices found that wrist monitors had a margin of error of 5 to 10 points compared to standard upper arm devices. Recommendation: use a wrist monitor only when an upper arm cuff isn't an option, and follow the manufacturer's instructions carefully to ensure proper positioning. Mistake 10. Talking during measurement. Talking stimulates your nervous system, which can increase your blood pressure during measurement. It's a mistake often overlooked, especially in clinics where nurses ask questions during the process. Study fact. A 2016 study in the Journal of Clinical Nursing showed that talking during blood pressure measurement could raise readings by 5 to 10 points. Tip: stay silent and focus on breathing slowly and deeply while the cuff inflates. Mistake 11. Relying on a single reading. Blood pressure fluctuates throughout the day due to various factors, such as stress, meals, and activity levels. A single high reading does not necessarily mean you have hypertension. Key point: true hypertension is persistent and occurs consistently across multiple readings taken at different times of the day. Solution: take readings at least twice a day, morning and evening. Record readings over several days and calculate the average. The AHA recommends home monitoring to track blood pressure trends, which provides a clearer picture of your cardiovascular health. Why accurate blood pressure matters. High blood pressure, also called hypertension, is often termed the silent killer because it typically has no symptoms but can lead to serious conditions like heart attacks, strokes, and kidney failure. The World Health Organization, 2022, estimates that hypertension affects over 1.28 billion adults worldwide. Yet only 42% of those with high blood pressure are diagnosed and treated effectively. By avoiding these 11 common mistakes, you can ensure accurate readings, helping you and your doctor make informed decisions about your health. Final pro tips for accurate measurements. Stick to a routine. Measure your blood pressure at the same time each day for consistency. Use a validated device. Ensure your monitor is clinically approved and regularly calibrated. Log your readings. Keep a detailed record to share with your healthcare provider. Practice deep breathing. Relax before taking your measurement to stabilize your readings. Monitoring your blood pressure isn't just about numbers, it's about understanding your overall health. By addressing these mistakes, you can take control of your cardiovascular wellness and make proactive choices. If you found this video helpful, don't forget to like, subscribe, and share with others. Stay tuned for more tips on managing your health naturally. And if you're interested in learning how to lower your blood pressure without medications, check out the next video, where we'll explore natural, evidence-based strategies to keep your heart healthy.